Hi, my name's Sachi De Silva. I'm a GP at Clifton Medical and Surgical. I'm originally born in Sri Lanka actually, and then moved to New Zealand, grew up there, and then did my medical training at JCU, and then come back up to sort of enjoy lovely Cairns. And so today I want to talk about Irritable Bowel Syndrome, or IBS, which is a sort of common gastrointestinal gut disorder which is currently affecting about 1 in 5 Australians. We don't know the exact cause of IBS, but we do believe it is triggered by a gut infection or a serious life event or stressful event. And there's a few sort of contributing factors to it as well. So things such as food intolerances, imbalance in the gut bacteria, and we also believe that gut pain hypersensitivity plays a part. So the most common symptoms are abdominal pain or discomfort, which is usually associated with diarrhea, constipation, and or bloating. And then based on those symptoms, we can sort of classify it further into sort of four main groups really. One where the diarrhea is more common, one where the constipation is more common, one where both are more common, and one where neither are common. So it is known to affect women more often than men, and it's usually diagnosed under the age of 45. And people with IBS are also known to more commonly have mental health conditions such as anxiety or depression, and other medical conditions such as reflux disease, chronic fatigue syndrome, and fibromyalgia. So doctors usually diagnose IBS when they can prove that the symptoms are not due to an underlying physical gut disease or another medical condition which may have similar symptoms to IBS. So this is usually done through a thorough history, examination, blood tests, and poo tests. So in a small group of individuals, your doctor may feel like you may need a colonoscopy just to exclude any significant gut disease. Worrisome features that your GP may recognise are things such as symptoms after the age of 50, blood in your poo, unexplained weight loss, iron deficiency anemia, or any sort of family history of bowel cancer, celiac disease, or inflammatory bowel disease. The good thing is there's many treatment options available for irritable bowel syndrome. The one with the most amount of research is following a low FODMAPs diet. FODMAPs is an acronym that encompasses a group of carbohydrates, and it stands for fermentable, oligosaccharides, disaccharides, monosaccharides, and polyols. So what does this all mean? Well, it means that there is a bunch of food groups which are high in these sort of carbohydrates that cause problems for people with irritable bowel syndrome. So while this list is not exhaustive, you can find exhaustive lists and charts online or through your dietitian. So generally food groups such as milk products, wheat products, artificial sweeteners, certain beverages, certain fruits and vegetables, legumes, and certain nuts cause these symptoms in people. So while there is no cure for IBS, unfortunately, you can reduce symptoms by up to 50 to 80% by just following a low FODMAPs diet. So what does that involve? So usually it is a bit of hard work on your behalf. So there is a period of elimination of all the high FODMAPs foods for about 2 to 4 weeks to allow the gut to rest. And then generally your most favourite things from the high FODMAPs list you introduce back into your diet every 2 to 3 days, and then just see how that flares up your symptoms. And then you do this for a period of sort of 6 to 8 weeks, finding out what your triggers are, and then you sort of follow a maintenance diet. So rest assured that you will still be able to have your triggers, such as ice cream or something like that, in a small amount and occasionally, without causing sort of significant symptoms if you've been following a sort of a maintenance low FODMAPs diet. So there are other treatments available. So these include things like probiotics, medications to reduce sort of gut spasms, which can help with the pain, and then also a sort of a vast array of treatment for sort of the sort of other associated conditions, such as sort of mental health conditions. So whether that is sort of some relaxation therapy or sort of a referral to a psychologist, and some stress relaxation techniques. While the symptoms are obviously bothersome for people with IBS, it is also reassuring to know that there is no reduction in life expectancy, or it does not lead to any other serious disease. So most GPs will be able to start the diagnostic process of IBS and refer you as needed to a dietitian to sort of further discuss and sort of help you with the FODMAPs diet. And if your case is particularly complicated, they may need to refer you to a specialist gastroenterologist for sort of further investigations and a colonoscopy if needed. So some patients ask what's the difference between sort of irritable bowel syndrome and another sort of common term, so inflammatory bowel disease. So inflammatory bowel disease is a more sort of serious condition where there is actually physical gut damage due to a certain sort of a trigger, and where then the body starts to sort of attack the gut. Common conditions are sort of Crohn's disease or ulcerative colitis. So that's usually where people have sort of significant blood or mucus in their bowel. They're losing a lot of weight and they generally feel quite unwell. In comparison, irritable bowel syndrome is usually diagnosed when you've excluded inflammatory bowel disease and there is no sort of significant physical gut disease. So in summary, IBS is a really common disorder, and if you have any sort of bloating or abdominal pain or sort of change in bowel habit, it's probably a good idea to see your GP, and then sort of they can start the process of figuring out what's going on.